So, friends, our today's discussion is on hypertension, that is high blood pressure. What is it and how to prevent it? So, generally, every one of us know that a healthy person has normal blood pressure. So, what does exactly it mean? So, basically, each time when the heart beats, it pumps the blood in the vessels, and pressure is created in the vessel. This is known as blood pressure. So, it it this blood pressure rises and falls throughout the day, and when the blood pressure remains high for a longer time and is left untreated, this is known as hypertension, and it is a cause of serious implications on the complications on the health of the patient. So in generally, persistent increase in blood pressure higher than the normal pressure is known as hypertension. So this is the hypertension. So how does it occur? It develops usually over the time. It can happen because of unhealthy lifestyle, like when we don't have regular exercise, we have obesity, we smoke, and when high blood consumption of alcohol and stress is there. So high blood pressure usually develops not in one day, but it takes time, slowly and slowly, gradually and gradually, it develops. So there are risk factors which increase the risk of development of hypertension, and these are related to like age. When the age grows, the vessels become stiff, and blood pressure rises. Family history of the high blood pressure. When one or more persons are in the family are having high blood pressure, then the risk of hypertension is more in individuals of that family. Excess salt intake. As we all know, salt intake is a major factor which can raise blood pressure. So, not enough foods with potassium can also increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and canned foods, fatty foods, these all lead to persistent hypertension, and they lead to increase in the blood pressure. So another one major factor is stress. Though when person is stressed for a long time, and then it causes increase in the blood pressure. So moving on hypertension, what are the signs and symptoms? Usually initially it is a silent killer because patient does not have any signs and symptoms. It puts people on risk for several diseases, like it can lead to brain disease like stroke, it can lead to kidney disease, it can lead to heart disease, CAD, and even it can damage eye and cause blindness. So, early and accurate diagnosis of the blood pressure is utmost in the prevention of these complications. So, generally we symptoms when the symptoms occur, like they include like morning headaches, like dizziness, tiredness, vision changes, and buzzing in the ears, fatigue, nausea, etc. And if person experience one of these symptoms or more of these symptoms, then we should get his blood pressure done. The one thing which is very good, that is we can diagnose this hypertension very easily. We can measure it with an instrument called BP apparatus or sphygmomanometer. A blood pressure is recorded in two numbers. This that is systolic and diastolic. When the heart pumps and it contracts, this is known as systolic hypertension and systolic blood pressure. Sorry. And when the heart relaxes, the blood pressure which is measured is called as diastolic blood pressure. So a healthy individual or normal blood pressure is around 120 millimeter of systolic and 80 millimeter of diastolic normally. Here, the upper number indicates systolic blood pressure, while mean pressure in the vessel is it is the difference between the systolic and diastolic pressures. If the blood pressure level is more than 140 or 90 and it persists, it is known as hypertension, and patient is having higher BP. And the risk can be prevented and reduced by taking the following steps in the lifestyle. So, lifestyle modification is the major you can say defense against the hypertension and its complications. So number one is regular exercise. So one should have regular exercise, at least 40 minutes a day, brisk walk, and at least minimum 5 days a week is required. And healthy diet. Healthy diet, and you know what is there in the healthy diet. So it is a balanced diet. So it can be DASH diet or Mediterranean diet, eating less saturated fats. and total fat, and get plenty of the potassium, and limiting the amount of the sodium. This can and also limiting the alcohol and alcohol consumption. This can cause this can reduce the development of hypertension. So DASH stands for dietary approaches to stop hypertension diet. So this is a specific diet. DASH, you can say it is dietary approach to stop hypertension. So what is there in the DASH diet? It contains whole grains, fruits, vegetables, and low fat dairy products, and it decreases the saturated fats and cholesterol, and it can lower the blood pressure by up to 11 millimeter of mercury only by this DASH diet. So reduce sodium in your diet. Even a small amount of small reduction in the sodium can reduce the blood pressure to 5 to 6 millimeter. So when you combine this DASH diet, reduce sodium, exercise, you can control your blood pressure even without medicines. So how can you consider? Here are few tips how you can decrease the sodium. Read food labels. If possible, low sodium alternatives should be taken in the food and beverages you normally buy. Eat fewer processed foods. Processed foods usually contain high sodium and it should not be decreased. It should be decreased in the diet. So don't add sodium. So don't add salt. So added salt that causes more to the hypertension. So prevent adding salt in your diet. Now the most major factor is quit smoking. Smoking is one of the major risk factors for CAD and also for hypertension. So one should quit smoking as early as possible to improve the overall health and blood pressure. So when you have blood pressure, so you should have regular monitoring of the blood pressure so that it doesn't lead to complications. So regularly you can monitor at a self monitoring you can do at your home or with your doctor. So this regular monitoring and controlling of the hypertension, this can decrease the cardiovascular morbidity and mortality. So next is stress management. As you know, stress management is usually required for hypertension to be controlled. So focus on your this yoga, meditation, and all those, so that stress can be managed. Another is adherence to the medicine. So this is the utmost factor. Many patients they start with the medicines, but with the time they stop the taking medicines as they say of their blood pressure is normal, though it is because of the medicine, but they stop medicine and again blood pressure increases and this leads to the complication. So adhere to the your medicine what doctor has prescribed, and regular checkup of the BP is utmost important to prevent the damage by the hypertension. So at least I would like to suggest that there is nothing more precious than having a fit and healthy life, adopting healthy lifestyle to enjoy long and healthy life. High blood pressure can even cause morbidity and also it is cause of mortality. So get your blood pressure checked regularly, control it with your lifestyle modification, and also take medicines regularly if required, so that you can prevent these complications